Hi, everybody. Very good evening. I'm Dr. Haneesha. I'm a developmental pediatrician, currently based in Dubai, UAE. Firstly, I'd like to thank Autism Connect for the wonderful work they're doing. It's a really large community helping a lot of caregivers, professionals, families, and anybody who works around with individuals who are on the autism spectrum. Today, it's my pleasure. Thank you for the invite. We'd be talking a little about understanding autism, and I'd like to share about the journey right from diagnosis to inclusion and a little about neurodiversity and how it's so important for us to create a supportive environment to help individuals and also families who are dealing with children or have children on the autism spectrum, and perhaps work towards the theme of autism this year, which is moving from surviving to thriving. So it's important for us as a community to support them. And I'd like to share a little more about autism so there's a lot more awareness amongst us and we're able to support individuals and families a lot better. So I'll be running through the next 30 to 45 minutes about this. I have a presentation which I'll go through. So if you have any questions, you can just put it up in the chat box and we'll be happy to answer for you once we finish the talk. All right, so we're going to start with understanding a little bit about development before we go into autism. What exactly this is? Well, neurodevelopment is the development of the brain, and this happens as the maturation of the brain is going on. There's attainment of a lot of skills, right? And like you can see, the brain development starts right when the baby is in the mother's womb, in utero. And the development keeps continuing even after birth and maximizes in the first 5 years of life. So we do have a very, very crucial period in the first 5 years because there's 90% of the brain development that is taking place. And the connections are to the tune of millions, which means we're talking, as we're speaking, as we're interacting now, every second, the baby is forming millions of brain connections. And that's how high connectivity and neuroplastic ability the brain has. And as this is going on, the baby is learning a lot of skills. And these skills are what we see in children as milestones, right? So there are certain milestones which we see in certain ages when your baby is 3 months, 6 months, 1 year, 2 years, and so on and so forth. At every specific age point, we do see there are certain skills that the baby is learning. And these are called the developmental milestones as per neurotypical ways of presentation. And we often try to understand if these skills are appropriately developed for a particular age. Is there any delay or is there any difference? Now, when we talk about skills at an age, now what skills are we talking about? There's so many things the child learns. Now, for an ease of understanding, we try to see development in these 5 different areas, right? The first one is the physical development or the physical skills your baby attains. The gross skills like crawling, sitting, standing, walking, running, jumping, so on and so forth. The finer motor skills, which are the hand skills. If your baby is able to reach out, exchange objects, use a spoon, button, unbutton, or maybe tying a shoelace, holding a pencil, and so on and so forth. And the sensory system, which is how the child is understanding the world around them through their sensory experiences. And this plays a very important role to the topic which we are talking today, which I'll come in a bit later. The next aspect of skill which we try and understand is the language, speech, and communication, both in terms of receptive, which is how a child understands language and information presented to them, and how is the child able to express themselves and communicate, helping, requesting, or just social interactions that they establish, right? The third area is the cognitive part. Now, what do we mean when we say cognitive? Now, often we think cognition is intelligence, but there's a lot more to it. Like you can see here, the cognitive ability of a child is measured not just by their intelligence, but also by their attention, their memory, their executive functions, their critical thinking, and a very important aspect being social cognition, right? And again, this is a very, I would say, important point in today's talk because social cognition is something a lot of children on the autism spectrum or individuals on the spectrum tend to have difficulties with. while the rest of the cognition may vary from low average to being very high. The fourth aspect, one of the very crucial, often, I would say, unlearned or not very much recognized area is the socio-emotional learning. And we're moving into a world where we're not just looking at the IQ or intelligent quotient of a particular individual, but we are seeking or trying to understand a lot more about their socio-emotional. And in today's life, where it's so important for us to navigate the world around, it's important for us to have a good socio-emotional quotient, which in turn helps us to utilize our potential to the best of our abilities. So socio-emotional is how a child individual grows up connecting, regulating, understanding, communicating. And we often try to learn these in different areas, which is both yourself as well as the social awareness and establishing these connections or social skills. And the adaptive behaviors, which is a combination of this communication, social, and self-care, which helps us to navigate our day-to-day lives, right? And what helps a child learn these skills? Is it the nature, like is it the genetics, or is it the nurture, which is what is taught in the opportunities which are given to this child? Now, this was a debate, I would say, a long time ago, because certainly we understand now that every child is born with an inherent ability to learn a particular skill, and that's what's happening as the brain is developing. And what is important for us is to provide an environment which creates this opportunity for them to master the skill which they are emerging and lay the right foundation. So it's no longer nature versus nature, but rather it's nature and nurture. It's important to be able to nurture the skills that have been genetically designed for every child through their development. And when we look at learning these skills, how can we monitor them? Now, perhaps the parent is the best judge for the child, because you see them day in and day out. So you recognize what the child knows, what skills they're building, is there any concerns? And teachers often, who spend a lot of time with children who are into preschool and school age, will also help identify if there are any developmental concerns. Whereas screening is a more formal process, which the pediatrician or the specialist you take your child to tries to recognize at certain time frames to try and understand if there's any difference in these developmental aspects. Having understood a little bit about development, we also want to know if there is a diversity. Well, we all know diversity is a very normal variation of life, right? We are all diverse in terms of our physical appearances, our cultures, our language, our background, and diversity is a very aspect of richness adding into the complexities of human society. Similarly, we're also very different in our way the brain is working, right? And that's what is neurodiversity, the brain and its differences. Now, this is because the brain is incredibly complex, and the structures and functions could be very different, and each of us are very unique in the way we think, we learn, we understand the world around us. But sometimes we see that there is a commonality for a majority of us, but there is a smaller proportion in which this way of understanding and perceiving could be very different. And that's what is called neurodivergence or neurodivergent conditions. Now, why does it happen? Now, why do certain group of people perceive the world quite differently from the rest of them? Now, that's because the brain size or the regions of the brain could be different, or the connections which are happening within the brain could be very different. The chemicals in the brain which help carry information across different regions could be very different. The way we perceive the sensory environments and regulate, process it could be very different. The way we learn could be very, very different. The processing styles, our executive functions could be very different. And most importantly, how we respond to the environment could be very different. Now, when there can be so many permutation combinations which can explain the neuro difference in the smaller population. But what's important is to embrace these differences, because they're not disabled, they're not disordered, they're just different, right? And we need to focus on a more strength-based approach in these group of individuals to see how best can we make use of their differences and help them overcome their challenges. So when we say neurodivergent conditions, now how common is this difference we're talking about? It's about 15 to 20%, which means about 80% of the population have what we call a neurotypicality, a similar way of understanding, processing, and relating to the environment. whereas about 15 to 20% of them could have difference in the way this is happening. Well, like I said, they're just simply different. And if we have to group this population into different areas or how they are further subcategorized into differences, we have a vast majority of neurodivergent conditions. Now, one such condition is what we're going to discuss today, which is the autism spectrum disorder. Now, having a quick overview about what exactly is this autism. So like we said, it's a neurodivergent condition. It's a neurodevelopmental condition. Though it's called as an autism spectrum disorder, we'd like to consider it as an autism spectrum condition, which is a neurodifference. And what we understand, what is unique for these individuals with this condition is challenges in their social, communication, and behavioral aspects. And this can be very different from child to child. In fact, if you've seen one person or child with autism, you've just seen one, because it's so different from one person to another. And it's not very linear, and it could be very, very unique in the way they are. And how do we identify this challenge is by certain very specific criteria which help us understand this condition. One being a persistent difficulty in their social communication interactions and behaviors which could be very restricted, repetitive, or even sensory processing difficulties. And a combination of these two is what forms the core criteria to diagnose an individual with autism. And most importantly, these challenges significantly impair the day-to-day living and navigation that takes place. One of the very important and often overlooked aspect is the associations. Now, it's very rare that we find an autism spectrum individual having just these core deficits. Most often, we see them associated with other coexisting conditions, as common as sleep issues, which is there in about 50 to 60% of the children. 1/3 of them can have associated seizures. 30 to 40% of them could be nonverbal, and they have a higher likelihood of GI issues, immunity, the immunomodulations, and so on and so forth. And most important is also from the behavioral aspects. They have a very high coexistence of anxiety, hyperactivity, so coexisting ADHDs, mood disorders, anxieties, irritabilities, and so on and so forth. So it's important for us to not just recognize the core difficulties, but also the co-associated conditions, which are very, very common for these individuals. How common is this condition we're talking about? Now, rather, it's very, I would say, a bit drastic in the way we've been able to look at this change. Way back, say, 2 decades ago compared to now, we're talking about an almost 300+% increase in the prevalence of autism spectrum, which means 1 in 36 of us are on the spectrum, right? So we're seeing the number of people or individuals with this condition quite much on the rise, which again reinforces that we understand this condition better because it's quite common now, and we are able to support them and provide them with a lot more opportunities to thrive. Why does this happen? Now, a little bit about this. Although we do not have a specific cause which can correlate to this, we understand it's multifactorial. Genetics play a role, the environment plays a role, and how the environment is affecting the way our genetics are expressing, which is called epigenetics. So it's a combination of these factors which perhaps is postulated to cause the difference in the way the brain is wiring, leading to this condition and the challenges associated with it. And how does a child or an individual on the spectrum present? Now, perhaps for children, there are some of the early signs which we recognize. The most common concern a parent comes with is language. They say that the child's speech is delayed or it's not appropriately developed for their age. But on the contrary, what we notice is that social communication, which is lacking, which in turn is affecting the way they're able to use language in their communications. And what is the usual age the parents identify this concern is about 1 to 2 years on an average. At about 18 months is when they recognize some difference in the way they're communicating, engaging, and interacting. But most often the diagnosis gets delayed until about 3 to 4 years of age. Now, that's the average age at which most of them receive their diagnosis, right? And like I said, it's not just about the core concerns, but the challenging areas, which could be very, very different in each of these. Now, predominantly it affects the social communication, language, behaviors, sensory, emotional, and also the way they play and imitate and interact, which is a part of social again. So when we say social communication, as a caregiver or as a individual, how do we recognize this difference or difficulty? Some of the early signs which you see in children who are younger than 2 years of age is where they don't respond to their name. Their eye contact could be very fleeting or minimal. They don't understand social cues, or gestures are very limited, like say pointing or following. They often hand lead you or use your hand to gesture to something that they need to. They tend to not have a joint attention towards activities that take place. Now, these are some of the early social communication skills which could be limited or which could be absent based on child to child. Whereas in an older child, which means we're talking about children who are a little more into preschool and school age, who may have these early social skills, towards childhood may come up as difficulty in maintaining friendships, difficulty in initiating, or they have difficulty in understanding and sharing others' perspectives. Or it could also be difficulty in conversations, narrating, understanding humor, which are a little more advanced social skills, which can become very difficult for them, right? The next aspect is language. Language development is something which is preceded by pre-language skills, which means, let's say we're talking about a baby who's about 12 to 15 months, may not have a lot of words, right? We're just expecting few babbles and meaningful words, but they are able to communicate through pre-language. And what do we mean by that? We mean the eye contact, the back and forth babbling, laughing, interacting, using gestures, body language, and so on and so forth. Now, often one of the early signs we see is not even before language develops, these pre-language or pre-speech skills are lacking or limited in these children. And sometimes we do notice that they may start learning words, but they may be mostly learned, which means they know a lot of numbers, colors, rhymes, but they're not able to use words in their day-to-day communication. Language can be scripted, language can be repetitive, or sometimes they can have a normal language acquisition as well in these children. Emotional dysregulations are very common, leading to tantrum behaviors. They do have a unique insistence towards routine or patterns, which are very regulatory. They tend to have behaviors which could be very repetitive and interests which could be very restricted, which means they want to play with the same toy in a very similar manner, or arrange them in certain patterns, or be interested in certain things. Especially, we see a lot of them have a unique interest to dinosaurs, to space and galaxies, to numbers, to colors, to shapes. Or they may also have a very particular order in which they need to arrange or play and insist in the sameness. Now, these are some of the restricted and repetitive patterns which we do notice, along with sensory challenges, right? So these could be overwhelming to sounds, to different textures, to different sensory experiences that the child can either be overloaded or under avoiding these as well. And the way they play is also very different. You do notice that they either don't show much interest towards toys, or they could be preoccupied with a particular interest of the toy or particular part of it. And they often tend to have challenges in imaginative, constructive, and pretend play. And in jointly playing with others, they tend to be a lot more limited and prefer to play on their own. Having understood a little about some of the early symptoms or early, I would say rather, signs which they present with, the next step would be, okay, as a caregiver, I have understood that, these are something which I recognize in my child or somebody known to me. Now, how do we move forward with this? How do we understand this a lot better? Because we've picked up something, right? So usually it is the parents who raise concerns, like I said, because they know best about their child. And parental concern is one of the most important things when we look at, which means there is definitely something going on which needs further evaluation. Even baby visits, when the baby visits the doctor for their vaccinations, growth, and general visits, or even visits of sickness, the pediatrician or the specialist you visit tends to pick up on some of the early cues which may present as a delay or a difference. And sometimes the parent might go to the pediatrician for a specific concern related to this area. He's not developed speech, he's already 3, or he doesn't seem to respond to his name, or he or she doesn't seem to be interacting or communicating and playing with their peers. So this could be a reason for visit by itself. Nursery and school also sometimes raise concerns, either at the time of entrance or during the school years. They pick up some of these challenging symptoms. And also, in doubtful conditions, when there's a delayed speech, we're not too sure if it's just being on the spectrum or a speech delay, or the child's not responding to some kind of an intervention that has been started, or autism is a part of a complex developmental condition which is going on. So you can have various presentations on how these children, present to the clinic for a developmental pediatrician. And as a caregiver, what can you expect after a referral is done? You expect a good evaluation. You expect standardized assessments which help you understand your child better, both in terms of their development and a possible underlying diagnostic condition like autism. It's important that the family collaborates with the healthcare team to make an appropriate journey towards what's next after the diagnosis, right? So going through very quickly to understand what do we mean, or as a parent, what should I expect in the process of diagnosis for my child towards autism spectrum. So the first step is always identifying concerns. Like I said, it could be the parent, it could be your doctor, it could be the teachers or other healthcare professionals who've picked up that the child might be showing some developmental challenges which point towards a possibility of autism spectrum disorder. Now, once these core concerns are established, there's a referral process which goes on, referring them to a developmental pediatrician who has expertise in helping families and children with these conditions and following a holistic approach towards supporting them. And often there are some screening tools, the most common one being MChat, which is used. And this screening is done for children between tool is used for children between 16 to 30 months, often administered at 18 months vaccine visit, thereafter at 24 months, and again at 30 months. And this helps us to pick up if there is any bit of a risk that is identified and carried forward for further evaluation. Now, once you've been referred to the developmental pediatrician or a specialist who works with children on the autism spectrum, what do you expect? Now, as a caregiver, we expect the next step to be a detailed consultation, right? Now, this is very, very important because you're not just looking into the symptom or the challenge of the child, but you're looking into a whole lot of things around them, right from their family history, pedigree, what the parental environmental influences, the parental age, the antenatal and birth history of the child, because all these could have contributed or played a role in the child's development in quite a significant aspect. And we also try to understand the environment around, because we do know family dynamics, social environment, the learning opportunities play a very huge role in the way the child's attaining developmental milestones. So that gives us a much clearer perspective into what's going around the child as well, and not just with what is happening with the child. We also go through a very detailed history into the child's development across these aspects which we spoke about, their physical, their language, their cognitive, socio-communication areas, understanding what skills the child already has developed, what skills is the child lacking, and is there any difference in the way the child is building on these skills, right? And at the same time, not to forget, we also make it a point to screen the child for the commonly associated coexisting conditions, which tend to be sometimes as significant barrier as much as the core symptoms that are present. And what is also important to identify is the examination becomes very, very important. Most often, we see a larger proportion may not have any associated underlying syndromes, but we do know sometimes it could be a part of common genetic syndromes presenting like this. So we would not like to miss upon an underlying genetic condition which can potentially have autism as a presentation, or some of the common ones like Fragile X, Down syndrome, and other syndromes associated with autism being one of their presentation becomes very important. And also a lot of neurological or neurocutaneous syndromes which have this association. So basically, it's important to have an examination to make sure we're not missing out something which is underlying and causing this specific condition. And what would you expect after having a detailed chat with your developmental pediatrician is having a clinical assessment. So these are done using standardized tools which help understand your child's development and arrive at a diagnosis of the condition and the symptoms that are significantly causing barriers to your child's day-to-day life. It's also sometimes important for us to screen for associated conditions. Like I said, if we are suspecting a hearing difficulty in these children, or we have other blood tests which may be needed to evaluate further from a genetic perspective as well. And usually the clinical assessments are very collaborative, which means you have a team of the pediatrician, the psychologist, sometimes if needed, the other specialists of speech, behavior, occupational or physical therapy, the genetist. Everybody comes on board to be able to arrive at a very comprehensive understanding of the child's current condition. Well, in fact, the evaluation would not just be limited to the healthcare team. It's also very important for us to collaborate with schools, especially for children who are into nurseries, preschools, and school-age children, because it's important to understand the child beyond the clinical environment. So we do visit schools, or we have the team which visits schools to give us a better understanding of how this child is performing in a social environment. How are their behaviors? How do they interact in different structured and unstructured environments? And we often do have meetings with the teachers who help us understand the child's performance in such social environments a lot better and not restricted to the knowledge we have by seeing the child in the clinic. Now, once we've got this information from across, which means I've had a detailed chat with the parent, we've got information from the teachers, we've got information from the other caregivers, we've carried out our assessments, we've got a lot of information which needs to be compiled to help understand the child's development, behaviors, and also confirm the condition of autism, which we've evaluated for. And we make sure these are evidence-based, which means we have standardized criteria which help us understand in reaching an objectivity in terms of diagnosis, and also making sure we recognize the coexisting conditions which play a very important role in management. Now, once you've compiled these results and made a report, the next step is very crucial and important, and I would say this is one of the most important foundational or cornerstone steps, is to discuss this with the family. The family needs to have a very good understanding of these results, and it's important for them to be very, very involved in making a joint plan on how do we proceed in helping this child to thrive better, right? So these are individualized programs that we come across, and the management plans are often not a one-size-fits-all, right? Because every child, like we said, if you've seen one child, you've just seen one child. So it's very important through these assessments, the specialist has had a very accurate understanding of where exactly are your child's needs, where are their strengths, and can we kind of work around these strengths in helping them overcome the challenges. So we need to create a very tailored and individualized learning plan in helping the child overcome the specific difficulties that are there. The treatments often, I would say, I wouldn't call it a treatment because it's not a disorder we're trying to treat, but rather I'd say intervention or support is multimodal, right? Which means a lot of times you may need more than one to support the child. You'll need behavioral front, speech, physically, if there's any difficulties, occupational therapy, sensory integration therapies. You need integration from the school, which is from an educational point of view. Sometimes medications, although non-specific as a treatment for autism, medications may be important for the associated conditions, especially if the child has ADHD or severe challenging behaviors, significant anxiety, or other aspects which may need to be treated to help the symptoms or core symptoms be better handled. And of course, a lot of lifestyle modifications. But across this, like we see, what is extremely important is to have parents as parental training and have the parents as a strong collaborator in the joint plan of the individualized therapy for the child. And schools not just giving us information and done with it, but play a very, very important role in how the child is helped across, because that's the second place where the child spends maximum time with. So we want to collaborate with schools to help create inclusive environments, providing accommodations and modifications, and strengthening the support that they can provide to these children have better access to their learning environments. And the collaborations, again, not individual, which means it's not just the parent and the doctor, parent and the therapist, or the school and the doctor. It's going to be all of us being connected uniquely by the child, right? So which means the parents, the teachers, the caregivers, the healthcare professionals, the therapists, everybody is included towards the child's goals, and everybody is aware of what we're working on, what the strengths are, what the challenges are, and we are kind of interdisciplinarily working with each other to help support the child and the family to the best of their abilities, and advocating for the child's needs and services that they require. Well, a lot of times, once the planning is made, families are, or maybe I'd say not all, but few assume that, okay, so pretty much you've given us a diagnosis, you've given us a plan, and there it goes. So we're just going to go through the plan, and that's all is, what is the relation that we share. But often it's important to remember this is where the journey starts. Now, this is like the first step that you've had, and you've brought in different people on board to help your child. And it's a really important process to have them along the journey, because it's also important to help through the transitions and helping the child create a lot of awareness about this condition as they grow older and have abilities to self-advocate for themselves. And it's very, very important to also support the parents, especially for professionals who work with them. It's important to, I would say, support them in both accepting this and being committed to the whole process. And sometimes we have parents who are neurodivergent themselves. So it's important to also be able to support their mental health and support the best ways in which the family can be catering to the child. Ongoing follow-up is a very, very crucial process, like I mentioned, because it's not always a point A to point B, which is going to be very smooth. The development's extremely dynamic, and so is the intervention. So continuous monitoring with your specialist, with your team, is very important to make sure whether the interventions which have been suggested are bringing in the required changes. So you're tracking their progress and development. You're adjusting the interventions accordingly as the changes, circumstances change. You are overviewing the family dynamics, because we understand there's a lot of transition going on as well. There could be a new child, there could be a change of place, or there could be a change of school. And how is the child and this family adapting to these transitions becomes very, very important. And at every point, screening for coexisting conditions and seeing how much they are impacting the child becomes very, very important. So it's very, very crucial to follow up as per the needs of the child. It could be quarterly, it could be 6 monthly, or it depends child to child, but it's important to follow up back with your developmental pediatrician to make sure that we are progressing optimally and we're not stagnated on our results or progress as well. This is one of my favorite psychologists, Bronfriend Brenner, who has a psychosocial model, who discusses how the child is the center, and you have a lot of circles around like ripples, right? And each ripple is the environment the child has around them. The closest one has the most impact, and farther away has less impact. So we see how it's not just the school, the family, the doctors, or the healthcare professionals, but everybody around plays an important role. It could be your neighbors, it could be your extended family, it could be the workplace of the parents. As a community, we all share a space in this ecosystem. And therefore, for any of the listeners today, you're a parent, caregiver, teacher, professional, you form the core mesosystem for your child. Now, even if you do not fall into this category, very happy if you're attending the talk today, because as an ecosystem, you need to be understanding this condition. If you come across an individual, could be in your workspace, could be in a social setting, or could be somebody known to you who's on the autism spectrum, that we need to really, really support them by creating an environment which is very neuro-inclusive. One of the important questions which I do get from parents is, would my child being on the spectrum benefit from mainstream education? Well, we do have a lot of research which has gone into it, and they do believe providing children opportunities to interact with children in the mainstream or neurotypical children do give them a lot of opportunity to develop these skills. And it becomes important, rather, it would need, which means your child, again, this is a decision taken by the entire team, whether your child would benefit from having this. No, sometimes this could be very stressful for the child, and it doesn't make any, I would say, not a right decision, in a way that if it's stressing out your child to be in an environment which could be overwhelming, your child's not going to learn, right? Because it's only a happy brain that learns. So your child should feel safe and happy to be in an environment like that. So if that's what is we are able to create in a mainstream, then certainly your child would benefit from interacting with other children. And it's important that the classroom and the school is neuro-inclusive, which means we are able to adapt ourselves to the needs of your child, which means you're adapting the environment, providing them with visual schedules, using fidget materials, sensory corners, and so on. Also, providing them with more support. Maybe they need a teacher assistant or a shadow teacher, giving them instructions in smaller groups, using a very strength-based model to help learning and access learning become better. And also from a behavioral perspective, identifying what are the expectations, reinforcing them, and training the teachers as well to see how best they can support the child in learning. And like I said, the key is collaboration between the family, between the educators, between the healthcare professionals and therapists, because they form the key atmosphere around the child, and everybody needs to be well aware of what we're working towards to keep track of progress and have consistency in our results. Now, having understood a little bit about the journey and the inclusion, why is it so important for us to understand this topic today? Like we said, 90% of brain development happens by 5 years of age or less than 5 years of age, right? Which means at the 5th birthday, the baby's brain's almost as big as an adult. So we're talking about a foundation which is laid in the first 5 years, which are extremely, extremely crucial. And we want to utilize every bit of these connections which are happening in the early years to maximize the developmental outcomes of the child. So we want to start off early intervention and take in a holistic approach to best support these children from a very, very young age. And like I said, neuroplasticity talks about use it or lose it, which means these connections which are forming will continue to become stronger if you keep using them, just how you master a skill. And if you stop using those skills, the connections kind of become less stronger, weaker, and tend to just disappear, which means you may lose the skill. So we want to try and help these children use these skills, practice these skills so that they're stronger and they form a permanent connection across the areas of social communication and language. Now, this is one of my favorite pictures, which talks about how early intervention plays a very, very important role, right? So if you see the green graph, it talks about how the brain's ability to change and form these connections, which we call the neuroplasticity, decreases with age. So it's kind of maximum in the first 6 years, slows down by the time they're about 10, and further kind of maintains by 30 and then drops, right? While the yellow graph talks about how much support do we need to provide, or influence does the environment need to provide to bring about this change. And we see that a small amount of work, let's say a therapeutic intervention, brings a huge difference at an early years. Whereas much later, you need to put in maybe 200, 300, or 400% of effort to even bring in a small amount of change thereafter. So we want to not just work hard, but also work smart, utilize these early neuroplastic years and try bring in the best potential possible for the child. And do we have any evidence about this? Like, are we just saying do early intervention, or does that really work, is one of the common questions that we come across. Now, I've just had a couple of articles here, but you have hundreds and thousands of them which have proven time and again that early intervention is the key. The earlier they intervene, the better were the outcomes across for children on the spectrum and other neurodivergent conditions as well. And what they have noted when they followed up these children who were intervened very early was they had a very significant quality of life, which was better compared to those who did not receive early intervention, which means They had better skill development, they had lesser deficits, they had better health, they had lesser comorbid or coexisting conditions which developed as a secondary, they had better quality of life, better educational graduations at university and job outcomes, and overall they had better independence and quality of life. So we want this to be what is possible for every child who is on the spectrum or a neurodivergent condition. Some of the very frequently asked questions are, is it too early to diagnose? Can we wait, especially when we see children in the toddler age group or less than 3? Now, it's important that sometimes or most often, we may not be able to label a child for sure, especially when they are much younger. However, we can definitely identify some of the early symptoms and potentially see that they may be at risk or sub-threshold and start working on these and not wait for a diagnosis to start intervention. So if you recognize early symptoms, start intervention and potentially reevaluate at a later point to understand the diagnosis much better. But intervention becomes the key with or without diagnosis. Yes, diagnosis is very important, especially to start off and understand what you need to work around. But if you're not able to arrive at a particular diagnosis, it's all right. Start working on these skills and reevaluate at a later point of time. And whom do we often refer to? Like I said, we refer to experts who work around with families and children. And very important to have a team which works in a very comprehensive and collaborative way to provide the appropriate support. And how could we have made a difference to these children on the spectrum as a community or any part of what we are to the family? We surely can make a difference in how is building awareness, right? So awareness is the key because your eyes see only what your brain knows. So when you know, you're able to recognize these symptoms early, you're able to prompt referral to specialists appropriately, you're able to diagnose or start intervention appropriately and collaboratively create that circle of care for the child, which best supports through early intervention. And that's what brings better outcomes, which we want to provide to for every child and family. And perhaps, like I said, autism spectrum conditions or autism spectrum disorder is not a disability. We have a lot of times parents ask, do you think they're going to be normal? Do you think they're going to be able to do something in their life? Of course. So I always tell them that there is always and always hope, and we just need the right kind of advocacy. So here are just a couple of people whom we've picked up of very common public figures who are, who've been able to thrive and achieve to their best potentials, though they were on the autism spectrum. So perhaps there is hope, and it's important for us to recognize that every one of these individuals had the right support to overcome their challenges, to not let this neurodifference take over them, but rather let the strengths be highlighted and showcased so that they were able to show their true talent and strengths that they were gifted in this neurodiverse condition. So as a take-home message, one of the important things which I'd like to convey is there are a lot of neurodivergent conditions, one of which we've spoken about today is the autism spectrum, and we want us all to embrace neurodiversity. We do not want it to be stigmatized. We want it to be accepted. We want it to be included. We want to move in from a disorder or a disabled terminology towards differences with their own strengths. So let's focus on their strengths. Now, some of the children on the autism spectrum are amazing artists. They have an amazing talent for music. They have good intellectual cognitive abilities. They have fantastic executive function abilities. So try and focus, find what is the strength in your child and try to use that to optimize their learning and accessing to different things. Advocating for supportive environments is one of my favorite things to do. And I think every parent is an advocate for their child. And we want every child to also grow up being able to self-advocate for themselves. We want every teacher, professional, or whatever part you are, for the family who has an individual with autism spectrum, we want you all to advocate for them and be able to create a very neuro-inclusive environment. And it's important to help families to seek professional guidance who will be able to take them through this journey in both in terms of acceptance and commitment towards where they're reaching towards and promoting inclusivity and equity. So like we said, we want to move from surviving to thriving as per the autism awareness theme this year, which is just so beautifully explained, because that's what we need to create a goal towards. We have awareness, yes, but now we want acceptance, right? Awareness is you're just aware of this condition, but it's acceptance where you say, yes, I'm aware of this and I'm willing to do this and create this as a support to individuals who are on the spectrum. So let's all together, as audience, as professionals, to whoever is here today, I think every one of us play a very important role in being able to do that at different levels. And let's together make a difference when it really matters. Thank you. This is my email ID in case you have any questions that you would like to ask. You're more than welcome. We can possibly look up at the chat. If you have any questions, please drop down. And if not, if there's anything that you'd like to ask out, not in the chat, but in person, you can feel free to reach out on the email and we'd be happy to answer you. So we're just going to be here for a couple of minutes. Thank you all for whoever's been a part through the presentation. If you have any questions, we'll be here for a couple of more minutes. Feel free to just type in your questions and we'll be happy to answer. Thank you so much to Autism Connect for the wonderful event. If you have any questions, feel free to reach out to them or to us, and we'll be happy to get back to you in person and answer your questions. Wishing you all a great evening, and bye-bye.